Listen Up is back, exploring the healthcare war south of the border. Well, to help us sort that all out, we're joined by activist Bishop Harry Jackson Jr. He is the minister of Hope Christian Church in Washington, D.C., the author of Personal Faith, Public Policy, and Reverend Jim Wallace, the president of Sojourners and the author of The Great Awakening. Gentlemen, thank you for being with Listen Up TV.
Thank you.
Reverend Wallace, you have made this the frontline action plan for Sojourners. You're asking people to write, to petition, to get involved in the debate, to preach from it. Why does this matter so much to your faith community group?
Well, first of all, it's theological. God wants healing, not sickness. And healing is a vocation of the churches. We run hospitals and health clinics. And the system is broken. 46 million people in America. I know this surprises Canadians, but don't have health insurance. A recent study showed that 45,000 people a year in this country are dying attributable to not having health insurance. That's 120 a day. That's 1 every 12 minutes. This is a fundamental moral crisis for us. So we have to fix a broken system.
Okay, Bishop Harry Jackson, I watched you recently on C-SPAN. You called the healthcare reform at that press conference ungodly and evil. What do you mean? What are you so concerned about?
The system has been broken so long, and on the Hill, I believe that you have ideological gridlock. And so I believe the president's vision is a great vision. I believe, unfortunately, that our political minions on both sides don't have a clue. And that in this season of time, there has to be the voice of the church trying to direct in terms of moral priorities. I'm concerned about abortion. I'm also concerned about the fact that there are many people that if this is not navigated correctly, will die. And I'm someone who's a cancer survivor, for example, and I simply am saying we agree change has to happen. The question is how.
Okay, I would characterize that as I observe the debate, there is a difference that's being split from both of your voices in the church, and it is over the issue of abortion. And should abortion be funded in this healthcare debate or not? Jim, what's your perspective on that?
Well, as I've said, there are two fundamental issues for us. One is to make sure that everyone gets covered. The second is, in fact, that there be no federal funding for abortion in the healthcare reform. Most of us agree on that, and the president has committed to that principle, partly because we don't want the abortion issue and debate to sabotage healthcare reform. So a lot of us on the pro-choice and pro-life sides have agreed to abortion neutrality in this debate, which is we don't feel neutral about abortion, but we must not let the abortion debate really derail healthcare reform. So the way to do that is that current law should apply.
Okay, because there's a huge sanctity of life issue when you do consider the stats. 250,000, I think, is what Time Magazine quoted. Jim, you just said 1 person every 12 minutes dies because of a lack of health care. You're trying to balance that against both the end-of-life moral issues that there are concerns, the abortions. Is that, are you able to find the middle ground in that, Jim?
Well, I think we have to. I mean, there are people on the pro-life side who really are, I think, using the abortion issue to derail healthcare reform. They say that's the only moral issue. It's not when so many people are dying. That's got to be, for us, a moral question too. In fact, you provide healthcare for low-income women, you will reduce the abortion rate. Part of the reason abortion is, we have an abortion rate far too high for a civilized country here.
Absolutely.
But you support low-income women economically with health care. The studies show you'll reduce the abortion rates. A good health care will reduce abortions in this country. So I want to talk about coverage, universality, and if we do that, we'll find that common ground. But we have to not use our concerns on both sides to push an agenda that will derail the healthcare debate. It's interesting in Canada, as you know, the church has helped to lead the way in Canada for comprehensive health care reform. And I hope we can do that here too.
Let me
Okay,
interject
gentlemen,
one
can I just switch it over to the money issue right now? I'm sorry because
Okay.
our time is limited, but
No problem.
the money issue. You know, the biblical worldview is not utilitarian, that a person is worth the number of their years or those kinds of issues of productivity. How do you propose that America gets around its huge questions of the $1 trillion price tag to this? Bishop, let's start
Let me
with you.
interject one thing. Historically, as Jim already said, the church has been involved. 331, Constantine, in a sense, started modern hospitals. We talk about this in one of our books, Personal Faith, Public Policy. And in America, we had infirmaries sponsored by the church. I would say that something that's not been on the table is community partnerships. We need to have churches be involved in this whole process. I believe that there can be more community dollars that can help subsidize this thing if, in fact, we fully engage the community. And so I think we got to be creative. I think it would be immoral in that sense if we let price alone keep us from allowing everyone to have coverage. Why not be more creative? Fundamentally, those who are called to be, or on the left side, if you want to call it that, very often want government to pay exclusively for things. Very often those who are characterized as being far right want this to be just free market system or private dollars. And I'm saying, why not allow the church? We've got faith-based organizations and laws right now in the nation engage a little more. If I was in South Africa, as we have an outreach ministry there, we would be having a mobile clinic operate. We'd be doing interventions. We then would let people be installed or put into the hospitals. There's something like that should happen here locally.
All right, Jim, your perspective on that?
The reason the churches know so much about healthcare is that we run hospitals and do clinics, and we have to clean up the mess of a bad system. People fall through the cracks, and we take care of them time and time again. So many of our clinics, in fact, are subsidized by government dollars, and they should be. It's a matter of priorities. A budget is a moral document. It says who's important, what's important. We're spending billions and billions and billions on wars that many of us thought were not necessary. And yet, we got no money for health care. We can't let cost trump coverage.
We tried to put you two reverends together because you do represent what's described as the left and the right wing voices in the church. I don't like to divide the church that way. That is the way American politics seem to have divided the church. I hear there can be common ground on this healthcare issue. Are you going to remain divided, or is there a merging of the church's voice?
Let me say that both of us, I think, would agree, and we're friends, as you can tell, that religion shouldn't be squeezed into political categories. Left and right are not religious categories.
Absolutely not.
So what this shows this morning is that we can come together and find some common ground. If the churches could say both sides are making politics of this, which they are, and we want to talk about don't go left, don't go right, go deeper. What's the moral center here? And find that common ground. I think that's a very hopeful thing that might enable us to go forward.
All right.
Agreed.
Bishop Harry Jackson, Reverend Jim Wallace, thank you very much for being with us from Washington.
Thank you.
Thank you.
Well, the Canadian Church has weighed in on the U.S. healthcare debate. We'll find out what their position is when Listen Up returns.